Hello, welcome to today's presentations. We'll be talking about medication awareness strategies for older adults. My name is Claude and I'm a graduate nurse. Okay, we'll be talking about the relationship between the body and the drug and how they interact once the medication is taken. We'll also discuss strategies on how to adhere to medications. We'll be discussing about factors that affect one's ability to adhere to medications, so things that can um, make a person not to want to take their medications. We'll also look at what can or could happen if someone is not taking their medications. We'll also look at the impact of COVID on seniors and medication adherence or medication awareness. And so to start, we'll just look at how the body interact with the drug once it is administered. And so when the drug is administered, it undergoes 4 different stages. And there's absorption. And absorption is when the drug is taken either orally or some other form and just taken down into the bloodstream. And here the medication is still in its form, and the drug can be administered orally when you take a pill and water, just swallow intravenously into the blood, subcutaneously into the blood fat tissue. Inhalation, when you inhale, really there's not much to say there. It could be administered rectally into your rectum, and some few other various ways that can be administered. And then once the drug is absorbed, it is distributed into the throughout the body, and here it moves from its site of administration to the bloodstream, where it goes now to the tissues, cells, and appropriate receptors for binding. And here it's when an intense side effect happens because now the medication is being distributed throughout the body, and through the distribution process, some organs or receptors are very sensitive to certain medications. That's where you get the nausea, the vomiting, things like that. Um, and then metabolism is when the drug is broken down for absorption. So once the drug is taken into the bloodstream, it has to be broken down for the tissues to absorb. And so the main organ for metabolism is the liver, but your gastrointestinal tract, so your stomach, your guts, they also can metabolize certain drugs. Even your lungs can help metabolize certain drugs. And you can see on the picture here, there's ways of administering medications. It could be oral, intravenous, subcutaneous, transdermal into the um, muscles, inhalation, like I mentioned, and then your blood is what distributes the medication to different parts of the body, and then your kidneys, skin through sweats, kidneys through urine, and your gastrointestinal tract, so your gut, stomach, through feces, excrete the drug. So last process will be excretion. Like I said, it's when the remains of the drug, after it's been absorbed, metabolized, and distributed, the remains that the body doesn't need is now excreted. Could be through the kidneys, through urine, or liver, or lungs through air, or um, could be through your gastrointestinal tract through feces. Um, and yeah, and then we look at strategies on adhering to medications. Um, number one, um, number one strategy is to accept and integrate medications as part of your own life. A lot of seniors live with different chronic illnesses which require various uh, medications for management of those illnesses or diseases. And so understanding that this is now part of my life helps people, or will help someone to actually adhere to their medications. You also have you also want to have an understanding that the benefits of taking the medications outweigh the risk that is associated with the medications. And you want to also have adapt to medication side effects. It's easier said than done, but with taking a lot of medications comes side effects. It's just part of the chemical properties of medications. It also, some people or some seniors find the use of blister packs useful in terms of like reminding them on when to take the medications, what medications to take. So like, for example, on here, it has day of the week, and on the day of the week, on Sunday, you have morning, noon, evening, or night. So in each blister, there will be medications that have to be taken this certain time of the day. So this for this particular example, the person has to be able to read, understand, and follow directions. If they are confused, have Alzheimer or some other sort of dementia that affect their neurological function, this probably wouldn't be the best, but here's an example. Um, some apps are very useful. There's this one app called Midwatch, but I think it's for pay, unfortunately. It sets reminders on when to take the medication dosage. It also connects your pharmacy so you can actually refill or make your refills through the app before you run out of your prescription. Very useful. Uh, you wanna also, if possible, create a calendar about medications and their dosage. Prescription refills, like knowing that my medication will be running out on this date, so I need to put in a refill notice a week in advance so that I can have them delivered on time. You also want to accompany seniors or your loved ones to doctors or pharmacy appointments. The more care you're giving to your loved ones or seniors, the more um, likely they'll be able to adhere to medications schedule. Um, you can use an electronic pill organizer as shown in here. This one sounds an alarm on when to take the medication or when the medication is required. And you can see it has Monday, Tuesday, Wednesday, Thursday on there, and the number of pills that need to be taken. Um, uh, you also want to keep the medications in a well lit area for our seniors who probably have poor eyesight, poor vision. So if the medication is readily available in a place where they can easily access them and see them, it helps them not to miss their dosage or their doses. Um, Having spoken about strategies, we want to look at we will talk about factors that can affect someone's ability to take their medications. People have number one is personal beliefs. Some people don't believe in taking some medications. An example is vaccine. We don't usually think of a vaccine as a medication, but as you can see, there are some people to this day who still don't want to take the vaccine, and that's understandable. So once you have that belief, you can't, you just can't because you don't believe in that sort of um, you don't believe in whatever's happening with that medication or vaccine or whatever's going on. And then the cost of the medication. Some medications are really expensive, and so buying the medication could become a difficulty. So cost of medication and financial difficulties sort of go together because you are financially burdened. You are not able to afford the medication you need. Like I was mentioning, the strategies that seniors or your loved ones have to be able to read or understand, um, or follow directions in terms of like using the blister packs and stuff. So then comes the cognitive impairment and dexterity issues. Some seniors have dexterity issues, so like they've got like tremors in their hands, so they can't really hold, they can't keep their hands steady to like take the medication, like the pills, and put them in their mouth and stuff like that. Or they're just not cognitively well in terms of remembering, or they're confused, stuff like that. And then the misunderstanding about the medication, like what it does, what it is for. Like if people don't know about their medications, what it is for and what it does, they are less likely um, to take the medication. And then if there's lack of trust in the healthcare provider, so like if I don't trust my doctor or my nurse, or my pharmacist, I'm less likely to take their medications. And then there's adverse drug reactions. So those side effects, people take having chemo, they get nauseous and vomit a lot. So with those kinds of things comes an unwillingness to maybe take those medications on a regular basis. Um, and just not admitting that you were sick or you were suffering from this kind of illness also plays a role. And then things that could happen when someone doesn't take the medications, increase hospital stays. If you don't take your medication, you're probably going to get more sick. And if you get more sick, you're probably going to need hospitalization. You're going to probably, you could probably end up in the community or nursing homes. Um, and sounds a little bit deep, but yeah, you could die from not taking your medications. Say, for example, if your illness uh, really depend on medications to be managed. If you don't take those medications, uh, eventually your body won't be able um, to help, but just give up. And once that happens, you are likely going to die. And then sometimes your disease just get worse or relapses, like you were getting better, but this because you stopped taking medications, you sort of like go back to the very beginning stage or early stage of the disease process because you just couldn't keep up with the medication. And then with COVID happening, the whole pandemic thing, um, big impact on seniors and their access to healthcare. But in general, for just general seniors, COVID, like seniors, when you grow up, you are very susceptible to infections, and that happens from um, a vulnerable or compromised immune system. And you are living with a lot of chronic illnesses, which puts you at risk of contracting a virus and making an illness that probably to a healthier person would be just easily managed, but because you're older and your immune system is compromised, it becomes a very risky condition. Uh, with COVID-19, we saw a decreased social tie between seniors, friends, and family because of those lockdown orders, which resulted in like self-isolation, loneliness, and emotional disconnectedness. A lot of mental health challenges, which increased the feeling of anxiety and depression among our seniors. Uh, there was like a lot, and this can be, you could see it from like loss of interest in activities that a person normally enjoys, but had have become disinterested all of a sudden for some reasons. You could see that from changes in sleep patterns or habits, uh, loss of appetite and weight, um, and increased feeling of sadness. But in terms of like healthcare access, COVID-19 posed a very big impact on our seniors. Uh, there was like you could see challenges in accessing medical treatment and healthcare because of lockdown orders, um, and the vulnerability of all the autoimmune system against infections. Like with because of COVID and how terrifying the virus is, especially to our loved seniors whose immune system is compromised. The chance of accessing medical care was reduced because of the fear of stepping out of the home or leaving your house to go to the hospital, knowing that if you contract the virus, you are probably going to get even more sicker. So you resort to staying at home. And then the shortage of hospital staff disrupts even more the provision of care, which will greatly impact seniors and result in delayed medical care. A lot of like right now, a lot of hospitals are very chronically understaffed or short-staffed, and because of that, people are not receiving the best care possible. And if that happens, there's delayed medical care to people, which could have great impact on health outcomes. And then we can see that um, many older adults require ongoing health needs, and these ongoing health needs require ongoing routine home-based visits. But because of the pandemic, a lot of those routines are disrupted and create a barrier to essential care and support for older adults. Uh, and the pandemic created very scarce resources around hospitals to the point that the a lot of diagnostic tests or surgical procedures were being um, postponed to just have place for those with COVID being taken care of. Now, once you postpone a diagnostic study or a surgery, it allows the disease to keep progressing, and the more progress, the more it can cause bad health outcomes. Increased cost of services where the seniors who could probably leave their house, go to a grocery store, can't anymore. So they're resorting to using delivery services such as Meals on Wheels, which will increase the cost of living. And because a lot of seniors also have a lot of medical conditions, those medical conditions require the use of a lot of different medications, which is known as polypharmacy. And so the burden of purchasing or buying those medications um, is even greater in this pandemic time. And that sort of concludes our presentation for today. I hope you learned something from the PowerPoint. And if you have any questions, you can write your questions to Maranatha African Mission, and we can happily be of help. and thank you for your time.